is Catherine Porras, and I will be performing a central venous catheter dressing change today. So before beginning, I will verify the provider's order, and I will gather all the necessary supplies. I will ensure that my hair is secured, my nails are clean and free of polish, and then I'm not wearing any jewelry. I will enter the patient's room, provide privacy by closing the curtain or door, and then perform hand hygiene. Hello, Mr. Smith. My name is Catherine, and I will be your nurse today. Can you please tell me your full name and date of birth? Perfect. So I verified 2 patient identifiers. Today I will be changing your central line dressing to help reduce the risk of infection. Do I have your permission to proceed? Perfect. So next, I'm gonna wear a mask, and then I'm also gonna ask the patient to wear a mask. If the patient is unable to wear one, I will ask them to turn their head away from the insertion site during the procedure. And anyone assisting with the procedure should also wear a mask. Okay, so I'm gonna perform hand hygiene, and then I'm gonna put on some clean gloves. So before removing the old dressing, I'm gonna assess the insertion site by gently palpating the surrounding area for tenderness, swelling, warmth, or any signs of fluid accumulation. So I'm also going to stabilize the catheter with my non-dominant hand, and then I'm going to carefully loosen the dressing by lifting the edges parallel to the skin. So I'm going to remove the dressing away from the insertion site to prevent accidental catheter dislodgement, and I'm going to discard the old dressing appropriately. So I am using this kind of skin, not the flat skin, because I don't have the flat skin anymore, and I'm hoping it's okay. I'm gonna discard this in the trash. Okay, I will inspect the insertion site for redness, drainage, swelling, bleeding, or other signs of infection. I'm also gonna assess the surrounding skin for irritation or breakdown, and check that the catheter remains secure and free from kinks or damage. So after the assessment, I'm going to remove my gloves, and then I'm going to perform hand hygiene. Okay, so now I am going to open the sterile dressing kit, and then I'm going to don some sterile gloves using proper sterile technique. So I already got it out, but this is the sterile gloves. I'll open the rest of the kit. Oh, this is another sterile gloves. So now from the kit, I am going to remove the sterile gauze. And then I am in the chlorhexidine. And then I am going to activate the chlorhexidine and allow the sponge to become fully saturated. Okay, so using the sterile gauze, I'm going to stabilize the catheter. And then I'm going to cleanse the insertion site with the chlorhexidine using a back and forth scrubbing motion for at least 30 seconds. And I'm going to clean an area slightly larger than the dressing size. And I'm going to thoroughly cleanse the catheter tubing above and below the insertion site. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. Okay, and then I'm gonna, right here, so I almost forgot. Okay, and then I'm gonna allow the area to air dry completely. And I'm not gonna fan or blow on or touch the cleaned area during drying. So once it's dry, I'm gonna apply the new transparent dressing over the insertion site. Okay, so I'm gonna smooth it carefully to minimize wrinkles and any air bubbles. And then I'm gonna secure the dressing according to the facility policy. Okay, and then I'm gonna label the dressing with a date, time, and my initials, and then I'm gonna place the label on the edge of the dressing without covering the insertion site. So I am just gonna pretend to write date, time, initials, and pretend to stick it here without covering the insertion site. And then after the dressing is secured, I'm going to dispose of the used supplies, and then I'm going to remove my gloves. And then I'm going to remove my mask. And then I'm going to ensure that the patient is comfortable, and I'm going to place the bed in the lowest lock position and make sure the collet is within reach. And finally, I'm going to perform hand hygiene and then document the dressing change, including the condition of the insertion site, dressing appearance, patient tolerance, and any abnormal findings.